Coming to our next lecture about tetracyclines and chloramphenicol. So this is the next category of antibiotic medications, that is tetracyclines and chloramphenicol. So we are again going to see each one of them, their classification, mechanism of action, uses, adverse effects, etc. So coming to the first category, that is tetracyclines. So these tetracyclines, they are broad spectrum antibiotics and they are active against gram-positive and gram-negative. Obviously they are broad spectrum, so they cover majority of the bacteria. But they are bacteriostatic in nature and the mechanism by which they act is they cause inhibition of protein synthesis. Now, how do they cause the inhibition of protein synthesis? We will see in detail while we are seeing the mechanism of action. The first tetracycline which was synthesized or isolated was the chlor-tetracycline, and it was isolated from Streptomyces aureofaciens. Oxytetracycline was derived from another bacteria, that is Streptomyces ramosis. So these are the two important tetracyclines which are isolated from the bacteria Streptomyces aureofaciens and Streptomyces ramosis. Similar to sulfonamides, tetracyclines are also classified based on the half-life. They are classified into short-acting, intermediate-acting, and long-acting. So the short-acting tetracyclines shows an effect for about 6 to 8 hours. Intermediate-acting have the half-life for 12 hours and long-acting have the half-life for 16 to 18 hours. There is one drug which is having a half-life of 36 hours also, which is tigecycline. So similar to sulfonamide, they are also classified as short-acting, intermediate-acting, and long-acting. But the duration might be different. The duration is actually different from that of sulfonamides. Okay, but the classification depends upon the half-life. Coming to the mechanism of action, as we have seen that it acts by inhibiting the protein synthesis. Now, how does it inhibit the protein synthesis? It binds to the ribosomes. It binds to the ribosome and inhibit the synthesis of protein. So how is it binding to the ribosome? As you all know that the ribosome has two subunits, the 50S subunit and the 30S subunit. So these tetracyclines, they bind to the 30S subunit of the ribosome and they inhibit the formation of proteins. So before we actually understand the mechanism of tetracyclines, we will first see what is actually happening in the bacteria to produce the protein. So there are two subunits, 50 and 30, and there are three sites, the A site, the P site, and there is one more site, that is the E site. A site is known as the acceptor site, P site is known as the peptidyl site, and E site is known as the exit site. So at the A site, the acceptor site, an amino acyl tRNA will come and attach here, and this is happening on the mRNA template. So this tRNA will attach here and it is having one amino acid, and this process goes on. So from the A site it gets transferred to the P site, and at the P site again what will happen, one more amino acid will attach, then again it will go to another site and amino acid will attach. So group of amino acids leads to the formation of a protein, right? Finally it will go to the E site and it will exit from there. So that leads to the formation of a protein, right? So the drug tetracycline, what is it causing? It is causing the inhibition of protein synthesis. So how is it causing the inhibition of protein synthesis? By stopping this mechanism. So how is it stopping this mechanism? It is stopping this mechanism by blocking the A site. So you can see here tetracycline will come and block the A site and it will not allow the tRNA to bind to the A site, which is situated on the 30S ribosome. So once this site is blocked, this complete step will be blocked and there will be no synthesis of protein. So this is the mechanism by which tetracycline inhibits the protein synthesis. How? By blocking the A site on the 30S subunit of the ribosome and inhibiting the binding of tRNA on the A site. Once it blocks the A site, it will ultimately block the synthesis of the protein. So the same thing is written over here. Tetracycline first enter the microorganism through passive diffusion process and the drug gets accumulated inside the cell, and once it successfully goes inside the cell, it binds to the 30S subunit of the ribosome and it blocks the binding of tRNA, amino acyl tRNA on the acceptor site, that is the A site, on the mRNA ribosome complex. So as I told you, this everything is taking place on the mRNA template. So this is known as mRNA ribosome complex. Now because of this, what is happening? It is preventing the addition of amino acid to the growing peptide. So as the amino acids are adding, it will lead to the formation of protein. So it is inhibiting the addition of more and more amino acids. So this is how the tetracyclines are causing an inhibition of protein synthesis within the bacteria and showing a bacteriostatic effect by inhibiting the synthesis of protein. Resistance. So resistance is developed for tetracycline. So there are three mechanisms by which the bacteria causes resistance. The first one is impaired influx. That means it is not allowing the drug to come inside. If the drug is coming inside, it is causing efflux of the drug through a pump. Next is it is protecting the target site. What is the target site for tetracycline? The target site is ribosomes. So it is trying to protect the ribosomes. Next is enzymatic inactivation. It will produce certain enzymes which inactivates the drug and help in developing resistance in the bacteria. So these are the mechanisms by which the bacteria themselves develop resistance to tetracyclines. Next, we will see about the pharmacokinetics. The most important thing, as soon as any time you hear about tetracycline, you must remember that the absorption of tetracycline is impaired by food, especially dairy products and antacids. So tetracycline medications should not be given with dairy products and antacids. Dairy products means milk, curd, cheese, whatever dairy products are there. With that, tetracyclines cannot be prescribed. Except few tetracyclines such as doxycycline and minocycline, they do not have any, adverse effect when they are combined with different dairy products. But majority of the tetracyclines shows adverse effects when they are combined with dairy products or when they are given concurrently with dairy products. Especially it causes discoloration of the teeth. That is why it should not be given with milk or any other dairy products. And it is distributed well in the body and it is better absorbed after oral administration. Tigecycline, which is having a half-life of 36 hours, it is poorly absorbed orally, but it can be administered by intravenous route. If you see doxycycline, its half-life will be reduced if it is given with another medication such as phenytoin, barbiturates, carbamazepine, and alcohol. If somebody is chronic having alcoholism, then in such cases the half-life of doxycycline will be reduced by 50%. Next, coming to the therapeutic uses. So what are the uses of tetracyclines? It is used for a number of oral conditions such as orodental, that means oral and dental infections, Vincent infection, which is also known as trench mouth, and apart from that it is also beneficial in periodontal swellings or inflammations which is happening in the periodontal diseases. Acne can be treated, bronchitis, pneumonia, relapsing fever, non-tuberculosis infections, etc. can be treated. Treatment of, gonorrhea and syphilis can be seen if the patient is allergic to penicillin. Penicillins are can be used for this treatment. Also, tetracyclines can be used if the patient is not if the patient is allergic or developing hypersensitivity to penicillin. It can be used in combination with other medication to treat gastric and duodenal ulcers. Therapeutic uses, as we have just now seen about the other therapeutic uses, more number of therapeutic uses are, it is used in skin infections, ophthalmic infections. Also it can be used as a prophylaxis and treatment to traveler's diarrhea. Now traveler's diarrhea can be due to many different types of bacteria. We had studied in our first semester in the lecture of diarrheas that traveler's diarrhea can be treated with cotrimoxazole, right? So here it is saying that it can be treated with tetracycline, but traveler's diarrhea does not mean that it is caused by one bacteria. It can be caused by other bacteria also. So tetracyclines are also equally effective in either prophylaxis or treatment of traveler's bacteria, no, diarrhea, sorry. It is also used in the treatment of amoebiasis, and it is used as a prophylactic medication of to treat malaria. Next, coming to the adverse effects. Simple adverse effects are epigastric pain, hepatotoxicity can be seen, phototoxicity can be seen. Phototoxicity means the patient becomes sensitive to sunlight. Vestibular toxicity means damage to the vestibular nerve which is present in the ear, which helps in balancing the body. So that toxicity will be seen. And as I told you, if calcium is combined with tetracycline, these chelates, it gets deposited in the teeth and bone, so causing teeth discoloration. And if it is given in pregnancy and childhood, it will cause suppression of the bone growth. And super infections are seen with tetracycline. That means the patient might develop other type of infections. It is contraindicated in pregnancy, lactation, and childhood. Also, people who are on diuretic medications, especially the hypertensive people, if they are taking diuretics, in such type of people, if tetracycline is given, blood urea level will rise, and it can be given in combination with penicillins also. So this is about tetracyclines. So tetracyclines, now that tetracyclines are responsible for proteins, inhibition of protein synthesis within the bacteria, and they are bacteriostatic in nature. They are also classified according to their half-lives: short acting, intermediate acting, long acting. And this is the mechanism by which they inhibit the protein synthesis by binding to the 30S subunit of bacterial ribosome. This is the mechanism by which the bacteria develops resistance to tetracycline, and it must be avoided to give with milk, the dairy products. Dairy products will not go together with tetracycline because the tetracycline calcium chelates gets deposited in the bone and the teeth, and causing teeth discoloration or bone suppression in childhood if it is given. These are the therapeutic uses, adverse effects, and precautions of tetracyclines. Next category of drug is chloramphenicol. Now, chloramphenicol is also a broad spectrum antibiotic, and it is obtained from the bacteria Streptomyces venezuelae, and it was obtained from this bacteria, but now it can be synthetically produced also. Because it is broad spectrum, it can be active against both gram positive and gram negative. Now I have clubbed both these categories together because the mechanism of action is more or less same. However, this chloramphenicol is also inhibiting the protein synthesis. Tetracycline was also inhibiting the protein synthesis. But as you know that for the synthesis of protein or for the synthesis of DNA, there are multiple steps which takes place, and ultimately it leads to the synthesis of protein or DNA. So here also it is inhibiting the synthesis of protein, but how? It is binding to the 50S subunit of the ribosome. So this is the 50S subunit. So it is binding to the 50S subunit of the ribosome. And which step is it inhibiting? It is inhibiting the transfer step, the peptidyl transferase step. So here, as you can see, if you compare it with the mechanism of action of tetracycline, the amino acyl tRNA is binded here. In tetracycline, this was inhibited, but here it is bound already to the 30S subunit. This is the 30S subunit. After that, I told you this will get transferred from the A site to the P site. Here, chloramphenicol drug, what is it doing? It is inhibiting the transfer. You can see a cross mark here. So it is inhibiting the transfer of the amino acyl tRNA to the P site. So if this is inhibited, ultimately what will happen? The protein synthesis will be inhibited. So this is the mechanism. The mechanism is little bit different, but the ultimate goal is same. That is the inhibition of protein synthesis, and the binding site is different. Here it is 50S. For tetracyclines, it is 30S. Resistance occurs due to enzymatic inactivation. That means the bacteria produces certain enzyme which leads to the inactivation of chloramphenicol. What is that enzyme? Chloramphenicol acetyl transferase. So this enzyme is produced by the bacteria and it helps to inactivate the drug. Pharmacokinetics. This medication is also widely distributed. It crosses the blood-brain barrier, placental barrier, and parenteral formulation is a prodrug. You know what is a prodrug. So the prodrug here is chloramphenicol succinate, and which goes inside the body and becomes chloramphenicol, and it is excreted through urine. Clinical uses. Coming to the uses, it is used in eye and ear infections. It can be used in the treatment of meningitis, UTI, and other anaerobic infections which are specially caused by the bacteria fragilis. Bacteroides fragilis. Actually, bacteroides fragilis. Okay. It is actually bacteria fragilis. Okay. Next is bacterial resistance. So, because of bacterial development of bacterial resistance and because of certain toxic effects, there are other alternatives which are present, which can be replaced with chloramphenicol. However, it is used in the treatment of typhus fever and Rocky Mountain spotted fever. These two are bacterial, infections, and this Rocky Mountain spotted fever, it is usually occurs due to a bite of an insect. And due to that, what will happen? Fever, headache, rashes will be developed in the patient. So it can be used for these conditions. For other conditions, because of its toxicity and resistance, other medications can be preferred. Now, what are the toxicity? We are concerned about the toxicity. The most important toxicity which you might remember is the gray baby syndrome. So this is the chloramphenicol which we had studied in the first semester about the gray baby syndrome. And apart from that, nausea, vomiting, diarrhea can be seen, and oral and vaginal candidiasis will be seen because of the change in the normal bacterial flora of the body. Bone marrow depression will be seen, and thrombocytopenia, anemia, aplastic anemia, granulocytosis, all these conditions will be seen. So these conditions are a little bit grave conditions, and gray baby syndrome is also a very grave adverse effect. So because of these dangerous adverse effects, other medications can be used as alternative to chloramphenicol. Apart from these adverse effects, it is having interactions with another drug. So chloramphenicol, so all these are the interactions. So this is about the chloramphenicol. The mechanism of action, pharmacokinetics, the uses of chloramphenicol, importantly the adverse effects, that is the gray baby syndrome. You know what is gray baby syndrome, and the interaction of chloramphenicol with other medications. So I hope it is clear for all of you.